Hello, and welcome to the Be Well and Thrive podcast with me, your host, Dr. Bill Renkus of Movement First Physical Therapy. My goal is to provide you with access to providers, trainers, coaches, dietitians, and influencers in the Triangle area so that you can get a glimpse into what they can offer and hear their point of view on health and wellness. So, I hope you enjoy, be well, and thrive. Hey everyone, this is Dr. Bill Renkus here with Movement First Physical Therapy. I am joined today on Be Well and Thrive with Dr. Mike Harris of Carolina Family Practice. And he has been a wonderful person to me in my career as a physical therapist as well as with my health. He is a graduate of NC State in the area for undergrad and for graduate school and for med school ECU. And then he was torn back to Raleigh to work at Carolina Family Practice specifically because he believed so much in that practice. Dr. Mike, thank you so much for joining me. I appreciate your time, and what I'd like for people to hear is just a little brief introduction into yourself, what makes you you, and then also a little bit about what brought you into healthcare, what made you want to be a physician, what made you, get to where you are today.
Well, absolutely happy to be with you, Sorry, Bill. It's you've been wonderful to work with in the past as well too, and I know that you're doing a great job, even though you're not across the hall from me anymore, man. Yeah, originally from Raleigh. Grew up here. Went to Sanderson High School, then went on to NC State. My parents are from Eastern North Carolina, so I did my med school down there. When I was down there, I met a woman crazy enough to want to marry me, and she's actually a local pediatrician here now.
Cool.
She's from Raleigh as well too. So we decided to come back, set up shop in Raleigh. I had previously worked doing internship with Carolina Family Practice in sports medicine, 10, 12 plus years ago. So all of my partners, the guys that I work with, have known me for a really long time, and I've known them too. And so honestly, what really brought me back to the area, I think, was kind of two things. One, specifically, I love this community. I love this area. I'm passionate about the Triangle area, Raleigh. I wanted my kids to grow up in the area. I wanted them to, experience a lot of the same value that I had growing up in this area as well too. And then joining the practice that I joined, they were just very, very sort of similar mindset. As a practice, we're set up as a primary care first, so sort of our base is pretty hardcore family medicine sort of stuff, and then obviously, we layer on sports medicine on top of that, which is obviously where you and I have crossed paths in the past with, working with a lot of, non-operative sports medicine, primary care sports medicine patients. But I've also had the good fortune in this area to work with some of the professional organizations. One of the docs that helps out with the Carolina Ballet. I'm the medical director for North Carolina FC Football Club in the area. I'm the team physician for Wakefield High School. And our practice also works with the Hurricanes and the Carolina Courage and you name it. I mean, we pretty much do it in the area and we absolutely love it. So just wonderful people, really, really good way to sort of, get, grow roots in the area and stay passionate about what we love.
That's awesome. It's incredible to, and I know your passion for your average Joes and your skill that you can definitely take care of the people who are, in the professional realm. One thing my experience with you is that passion as well as your ability to kind of just keep it real and care about your patient. So I'm curious as to, what drew you towards sports. I know you do have the primary care, and we'll definitely get into that. What drew you towards the sports side of things? Did you play sports, or was there anything involvement there that made you kind of feel like you wanted to get involved?
Oh yeah, man. That pretty much all of us did. I mean, I think, every single one of my partners, all of our associate docs, every single one of us are former athletes. We spent some portion of our formative years injured or in need of some medical assistance or physical therapy or training or whatever it is. So uh, I think it's pretty organic, I guess you could say,
Mhm.
that kind of came from it.
Mhm.
But yeah, I mean, and especially in regards to primary care medicine, I mean, in the context in which we practice, we like to be able to have um, kind of an approach to the entire patient. And we do, all the standard, physicals, all that type of stuff, med management. I mean, I've got a background in some pretty hardcore medicine stuff, lots of cardiac issues, diabetes, blood pressure, kidney issues. But to be able to layer on top, I mean, everybody has aches and pains. Everybody has stuff that's sort of, kind of getting in the way of what it is that they want to do. And I think that kind of you and I probably share that same passion for getting them a chance to do it.
Yeah, absolutely. What do you feel like is some of the most common issues that you hear people coming in complaining about, whether it's the 30 something old mom, or who's got young kids, or whether it's the older mom or dad who has they're getting towards that end of career age, and
Sure.
kids are leaving the nest. What kind of things are they dealing with?
I think on the front side, we get a fair amount of overuse injuries, patients that are, trying to maintain whatever level of activity that they've had for so long. Maybe, kids are on board, they've taken a time off, they're training for, a half marathon or triathlon or something it is that they want to keep doing, something that they're passionate about and that we know is going to help with their mental health and physical health and everything. And so we see a whole bunch of the overuse stuff, patellofemoral pain issues, IT band syndrome, gluteal low back issues, all of the, the foot stuff, heel, plantar fasciitis, a ton of that type of stuff. Of course, we have a lot of guys that are still trying, especially in that age, lift weight, stuff like that. So, we see some of the overuse stuff in the shoulder, back area as well, too. Um, on the other end of the spectrum, obviously you got people that are just trying to, you know, do everything they can to maintain mobility, maintain, they want to be able to, play with their grandkids. They want to be able to take walks around the park. Some of them are still playing tennis and golf and stuff that we want to do too. So,
Mhm.
a lot of arthritis in that point,
Mhm.
knee issues, hip issues. So we have the opportunity to hopefully intervene on a lot of those things, whether it's with solid home exercise therapy program that's designed by our staff athletic trainers, or to obviously work closely with somebody like yourself and hopefully get the best outcomes we can without necessarily having to have people go under the knife all the time. We
Mhm.
do a lot of therapeutic injections, things like that as well too. But pretty much whatever it takes to keep people out there. Let them stay as healthy as they want to be.
Yeah, keep them doing the things that they love doing. I mean, that's why they come to see you. It's they say, a lot of times people will come in and say it's a pain that they're dealing with, but in reality it's the fact that they can't go for that run, which helps them, basically decompress after a long day of work, or you know just relax and have their own time. And so yeah, it's so important to be able to, on your side, be able to bridge that gap, whether it's with injection or with your athletic trainers, or like you said, kind of really giving that strong recommendation for them to get further assistance. um,
Yeah.
what
Well, I tell people a lot of times, I'm like, if I were to come to you and tell you that I got a treatment for you that will help control your blood pressure, reduce your risk of cardiovascular disease, diabetes, help you sleep at night, reduce stress, maybe even help out with things that are important in marriage, sexual performance, whatever it is that's and there'd be like one treatment, just one treatment.
Yeah.
You're like, yep, just one treatment, man. Activity, if
Yeah,
we can get you going, if we can get you moving, we can get you doing that stuff.
that's right.
It's better than any pill that we
Yeah,
can prescribe. So we
I
know that, man.
side effects of sweat, fatigue, a little bit of momentary fatigue, and a little bit of effort. Yeah, that's great.
Yeah.
I love it. I love it. That's great. I'll have to use that. Um, One thing I know you do is, and I'm curious how you kind of got to this within your practice. I always value how you kind of allow allow your patients, or you work with your patients. You kind of get their side of kind of the side of the story, as well as side of kind of what they're looking for, and how they want help. And so I'm wondering how you kind of started doing that, and how you got to involve your patients in their own care.
Yet again, I think this is probably a pretty organic process. You know, um, uh, to some extent, I think a lot of us, if you were to take any of us that's been practicing for any, period of time, we're probably some sort of an amalgam of all of the training techniques and clinical techniques that we've seen. I think anybody that gets to this sort of point in their life, in any background, whether it's, pharmacy, physical therapy, occupational therapy, doctor, I mean, we all are, right? So, you kind of take, right, you cherry pick, little things you like, little things you didn't. You recognize, things that really work and things that got along or got across to people. But I think the one thing that I really, really, really enjoy, and I find most patients do as well too, is getting a chance to actually build a relationship. I mean, I want to know who you are, and what's important to you. What are your goals, and what's it going to take to get there, and it's building the relationship part of primary care medicine is such a therapeutic tool. um and I tell people all the time, I'm like, I only know one way how to do this. I'm kind of old school in the way that I think. I enjoy getting to know people. I really like hearing their stories. I kind of like sharing mine as well too. I mean, a little give and a take there. But when the patient comes back to see you, it's kind of like a homecoming. I mean, that construct of trust and comfortableness, uh, I think is incredibly valuable to individual patients. And they're willing to work with you. They know that you care. I mean, I tell people all the time, I mean, like, even kids know if you're sort of fake, I mean, kids can tell, right? They're pretty smart. But um kind of everybody can, and you can't come from that place. You have to be willing to put forth a piece of yourself in what you do. And so I've even been told in the past by certain people, that I was definitely a little different than other doctors that they've come across. And I don't know if that's good or bad. I'll leave that up to the individual person as to whether they like it or not. But it's kind of just how I roll. It's what I like. I mean, I don't feel like I can effectively do my job unless I know more about you.
Yeah, no, absolutely. That's huge. Knowing who a person is, where they're coming from, what their family life is like, what their values are. And I mean, you can do that, yeah, with a very quick conversation, and just caring, like you said. I Unfortunately, in the health field all around, it's kind of, people are starting to feel more and more, um, I guess, less and less human, and more like a number, or just another statistic. And I
Sure.
think what you bring to the table, and what I try to bring to the table, is that human element of, how was your day? How was your family? Um, what's new in that realm, because that can also tell you stuff too. Like
Yeah.
you said, you can't treat them to the best of your ability if you don't know all the things that are going on. So that's awesome, and again, something I really appreciate about you. I was curious about how important the primary care aspect of everything, ties into sports medicine, or even with your professionals. So, like, whether it's, again, your average Joes or your pro, what aspect of primary care do you feel like maybe not is most important, but why do you think that like kind of having that general health and awareness of what's going on in that health aspect is so important for the sports level?
So, from the standpoint of like working with our professional athletes, I mean, these are people with, elite abilities. They're
Speaking-
got some, can do some stuff that you and I can't for sure. um, but uh, but since we're not the orthopedist, the orthopedist obviously, if there's, an ACL tear, slap lesion, whatever sort of winds up happening, broken bone, things like, I mean, if something needs to be fixed, I mean, they're going to take care of it. I mean, we're going to help diagnose it. We're going to help care for that patient. Um, but I think what I try to bring to the table there is kind of the human aspect. I mean, some of the guys, will actually come see me for physicals, flu shots, right? If they have problems with, their families or their kids, they'll come to me, or my wife. My wife actually has taken care of some of the professional players' kids before,
Mhm, mhm.
um, and so, kind of bringing them into the family, right? Giving them that support system, that caring structure that we all want and deserve, honestly. But
Yeah.
so I think that, being the primary care doc, we have that kind of more human
Yeah.
reaction, I guess, or that more human ability to relate on all of those levels, right? I mean, if they get sick, they get a sniffle. Obviously, this past year, working with the professional teams, having to deal with COVID and COVID testing and tons of recommendations and protocols and regulations. Um, it's tough, and it's really hard for them to kind of filter through what that means. And it's not easy on the trainers. It's definitely not easy on the coaches, and it's our job to kind of translate that in the best way possible. But when you break that down to the even like the average Joe like you and me, um, you know, understanding the primary care component, I just find that people really, really, really like to have that option where, yeah, they come to see you for their blood pressure and they just got some lab work recently or thyroid studies, but they're also like, hey man, this hamstring thing I've got going on is just kind of crushing me, and what should I be doing here, and it's just that sort of added layer of, you've kind of already built a trust with that patient, which I think a lot of us take really seriously in regards to what that trust means, and then what we can sort of help them out with on other fronts and long term. So, they trust you to figure out the hamstring thing,
Mhm.
the shin splint thing, the knee thing. And if they need surgery, we're the ones to tell them that sometimes too. And and you take the good with the bad. I mean, there's a lot of really great things that you get a chance to see people reach a lot of health goals. Maybe somebody run their first marathon or do some really cool stuff. I had some
Mhm.
patients that climbed Mount Kilimanjaro like 3 years ago. Um, they were a little older, kind of in their 60s, and they kind of crushed some people that were a lot younger than them heading up the mountain.
That's awesome.
Um, but some really neat stuff like that. Um, but you get the bad stuff as well too. Having to tell somebody that that they have cancer, or something that's gonna lead to a long road, something that's not gonna be tough, or that's not gonna be easy. That's gonna be tough, and that's gonna require more care, more instruction, more guidance. And and I sort of say the same thing to like my pro athletes and stuff that I do to my patient that I told that has cancer. Is I say, I'm not going anywhere. Um, I'm here. You got me. I'm going to go through this with you. If you need anything, you call me. And you got to kind of stand behind that.
Mhm. Yeah, for sure. How much do you feel like primary care is foundational to, um, whether a person can perform, whether at any level or at a high level?
Huge.
Yeah.
I mean, I mean, it's, if you don't have your underlying baseline health, then what do you have, right? And that's even if somebody has a more complex issue, chronic fatigue syndrome, autoimmune issues, whatever it is, right? I mean, things that are really kind of nebulous and are really hard to navigate through. You got to know that this sort of underlying stuff is okay. Hey, man, your kidney function, your liver function is in line. We have the ability to be able to do this treatment or not. Um, but you got to be able to kind of, pivot on a dime sometimes and say, and understand where that goes. But, the primary care aspect, just having people coming in, getting their physicals and just doing the baseline stuff, getting their immunizations,
Right.
keeping them from getting sick so that they can run that marathon that they want to run and stuff.
Right.
Um, of course, and it's paramount. It's the base of the whole thing for us.
Yeah. That's great. You with that, you're talking about making sure that people's bodies are well enough to do these things, and obviously, if they're not, you're treating them or recommending, outside treatment for them. Um, I've heard it said, and that sometimes our the current kind of system leans more towards sick care, right? So
Yeah.
you get sick, you go see a doctor. Your doctor helps you get through that sickness. Um, what types of things do you guys do for healthcare or well care, like to promote? Um, maybe not. I wouldn't expect you guys to get into kind of like biohacking and like ultimate living or whatever, but just like, what do you guys
Sure.
do to try and promote people to not only be like average but like above average, and help them be as healthy of individuals as they can be?
Right. And you're right. I mean, I think there's and this is, I mean, man, something like this between you and I could probably be a whole nother segment, right? About, what are the inherent deficiencies in the current healthcare model and things like that. You can get as, you know,
We'll keep it
kind
positive.
of, kind of, existential medicine as you want to on
Right.
that. But no, I mean, I do have that concern all the time. There's an online podcast presence, a guy named Z Dog. I don't know if you've ever heard
Mhm.
of him before. He's actually a doctor from, he used to be at Stanford. Um, and I'm trying to remember his name off the top of my head. It's Z Dog is like his moniker, but he kind of has this theory and this concept of what he called what used to be sort of health 1.0, which is where there was really no interference, right? It was doctors and patients, and it was as raw as it got, and that was it. And then this sort of health 2.0 model where we've layered on a lot of things, tons of specialists, lots of technology, communication stuff, people going in and out of hospital, transitions. I mean, stuff that I don't think that anybody ever would have thought would have been 50 years ago maybe. And then he talks about part of his journey is such that he got pretty disgruntled in that model, but he was an amazing doc and had impeccable credentials. Everybody loved him, and I mean, he's this like really highly thought of guy. But he was like, man, we're not getting through, right? Mainly because he cared, right? He cared about what was going on, and so he came up with this kind of model and this theory of what he calls Health 3.0, which is, uh, you know, where you still have the technology, you're not letting it rule your life, things like that, but from a primary care model, looking at this as bringing the human element more back into it, right? Doing these things, being able to do the screening tests, the labs, the immunizations, a lot of the things like kind of in-house in one place where you're not getting, you know, too many hands in the cookie jar, things like that, right? Because sometimes the more doctors you see, the more specialists you see, the more confusing things can get and the more aggravating I think patients can be with their general care, right? And there's been a lot of pushback within the confines of medicine for the last probably couple of decades since sort of I was in training and everything, that shifting back to a primary care model in an effort to incentivize good solid care, preventive care, right?
Mhm.
Understanding how we screen, what can we
Mhm.
screen, what are the correct actions to take, where is the right referral to make, when are you kind of being superfluous, and where are things that maybe we don't need and it's not going to make a difference. But it kind of that concept puts things right back at home, kind of on us to say, we got you covered, we got this thing, and we're going to do everything we can to prevent it. And I think, from a theoretical standpoint, in a very positive light, you know that's how we want it to be, right? Medicine is even talking about going from, fee for service over to, quality based measures, and they've been talking about that for years now.
Mhm.
um, and I don't think that, I mean, whether you like it or not, it's probably coming. Um, but for those of us that do primary care, we're all about quality,
Mhm.
and that's what we want. I mean, we want people to, understand how to hedge things off at the pass, how to reduce their cardiovascular risk, how to, reduce their injury issues with their, if it's just purely for, sports medicine purposes, musculoskeletal stuff. So, just that general theory is something that's been sort of kicked around for a long time. But I mean, we're pushing it hard, and I'd love to see it come to fruition completely.
Yeah.
But there's a lot of people out there that care about it, and I know that, and that makes me feel really good about it.
Yeah, absolutely. That's awesome. Yeah, definitely. I'm all about trying to help, you know, kind of just push people in the right direction. And that's kind of why I'm doing this podcast, is just, getting it out there that people, if they're having an issue with something, there's help out there, whether it is a primary care physician, whether it's a physical therapist, whether it's a nutritionist, um, you know,
Yeah,
psychologists, especially nowadays with all the things that people are going through. Um, yeah, it's definitely important to have that human element and that person that you can trust, that you're going to trust what they say, and not just think that they're kind of pushing you through the the cogs or the train or whatever.
yeah,
um
we all deserve that, man.
yeah, yeah. What do you feel like in kind of the general population might hold us back from that? Because I feel like, some people do want a specialist. People do
Hmm.
want, I mean, I've heard it tons of times where people are frustrated where they go see a hip doctor and they're like, "Oh, we can't look at your knee. Sorry, you gotta go see the knee guy." And I know they get frustrated with that, but what about it is kind of making it this so like specific, but then also people want specific. I guess I don't know if that's a question or not, or just what are your thoughts on that?
Yeah, I mean, I see what you're talking about, and obviously we have people that come in and they're like, "Hey, man, I want a referral for this," and maybe I've already looked at their knee, and I'm like, "Hey, I mean, based off of your exam, you got some, posterior medial meniscus issues. I mean, we can probably work through this a little bit, maybe some therapy, some stuff like that. I don't know that you need to take that route yet.
Right.
Do you need the MRI? Do you not?"
Right.
Um, that's an education thing,
Mhm.
as much as anything else. I think a lot of the insurance structures now tend to possibly incentivize that a little bit more, which yet again is probably another thing that you could have a whole nother segment on.
Yeah.
But I do feel like the structure in and of itself, and that kind of goes back to, kind of that sort of health 2.0 model that I was
Right.
talking about, is that there's just, I mean, there's inherent inefficiencies there,
Right.
I'm all about efficiency in my life, and at the clinic, and folks that I work with, with my kids, I want, find a shortcut to be able to pick them up quicker, stuff like that. How can we get them to bed faster? Whatever it is, you want it to be more efficient.
Mhm.
Um, but uh, but I mean, that's an educational process, and it is. It's very prime in nature to the standpoint as to what I think we do, and the way that we work with patients on kind of ground level, right?
Yeah.
Is to educate them as much as we can, and there's programs out there right now. So Joint Commission has things like primary care medical home ratings and things like this, which are pretty intensive in regards to understanding how to coordinate staff models. How do you integrate care between different specialists? What does your referral loops look like? How do you close the loops? What are the checkpoint safety things that you're doing within the clinic? I mean, all of these things. And if you get some of these certifications, they're the highest certification. You can say, yeah, I'm at the highest certification that you can.
Yeah.
But at the same time, I mean, I think it has to be a concerted effort,
Right.
from the ground level
Yeah.
to really educate.
Yeah. It sounds like, I mean, it sounds like with all those efforts is to try and not let that patient get lost in the shuffle. Like you said, referral loops and making sure that people are getting to the right people and following up. And when I think ultimately what it comes down to is do you care? And then do you have, again, do you have the time to care as well?
Yeah,
Um,
yeah,
Unfortunately, yeah, in some healthcare realms. But again, another topic. So one thing that I did want to get into was discussing kind of some of the current events that are going on when it comes to COVID-19, coronavirus, and kind of some of the things that people should know about and should kind of consider doing when it comes to
sure,
their own family health. You have some children, and what are you doing with your children to help them understand or kind of be safe, when they're at daycare or school. What has it been that you've told them that keeps them safe as well? So yeah,
sure.
so what are some things that you usually help patients understand about it and kind of keep them well?
Yeah. And so probably obviously one of the number one question things that we get right now, just even at regular physicals, what do you recommend? What do we do? uh Ridiculous amount of conflicting information out there, which is really, really hard.
Yeah.
From our perspective, we don't mind clarifying. That's not at
Mhm.
all like, I mean, that's our job. That's why we got into
Right.
this, right? But it is, you kind of sit there and you're like, man, you kind of feel like sometimes you're sort of fighting a ghost on those things. But um you know my wife, being a physician as well too. So how do we live our family life?
Mhm.
um well, I mean, luckily we have a really strong family structure. I think I'm pretty blessed with that. Healthy young kids. Uh, be it that the wife and I both work, and see patients, and yes, we've seen, both of us have seen and swabbed, patients that wound up being COVID positive, with the correct PPE on, taking every precaution that we can. You worry about bringing that home. You worry about bringing that to your family, and that's that whole added level of stress. One thing that we've done specifically to kind of, it's become a staple in our lives. You know, right when we get home from work, immediately to the shower. Get out of the work clothes that could be possibly contaminated. Wash what, take a shower, get clean, go start there. Cleanliness is kind of one of those really, really big things here. um from the kid's standpoint, I got one kid that's my oldest daughter. She's school age, and so she probably knows a little bit more and understands a little bit more about what's going on, and she'll say things like that, right? Hey, when the virus is over, hey daddy, the virus, this, that, right? I mean, she even plays with her dolls and puts masks on her dolls now and stuff. It's like
Yeah.
that new normal.
Yeah.
It's the reality of our lives. And I'm not one of those people that is necessarily trying to hide what's going on from my kids. I'm a doctor. It'd be pretty hard for me to anyways. But we want to let the kids know, like, if we do, go out to pick something up, if we do go to an outside thing, understanding the simple rules, right? I mean, and that's the thing that I find incredibly positive and sort of wonderful, is that, my 7-year-old, she can understand it, right? she can understand, I've got to wear a mask. Like, hold on, daddy, my mask isn't on. I'm like,
Hmm.
great, awesome, I love it.
So, Daddy, where's your mask?
Yeah, I mean, it's the stuff. It's like, but she's that stuff is really, really, really cool to see, her understanding that the things that she's doing are helping to keep her safe, her
Hmm.
family safe. I mean, my 2-year-old is my 2-year-old.
Hmm.
She's a little different, in regards to the understanding. She's pretty wide open,
Hmm.
but she pretty much just wants to be close to us at some point in times. But
Right.
that extends to our extended family too. The only times that we see the grandparents are outdoors. you know um you know I find it incredibly important in this particular time, and with this kind of, I don't know, you want to call it like an infinity effect, right? When is it over, right? When is it going to be over? To allow something human to happen, right? But you got to take the right precautions. And so it's one of those things that we get worried about in some of our older patients, right? Is the seclusion, right? That can lead to significant, mood instabilities. Sometimes maybe they're going to stop taking their medications. They're going to stop taking care of themselves. They feel like nobody cares. They can't see their family. They haven't seen their grandkids. I mean, it's crushing them inside. There's a huge, non-organic, behavioral component to this that cannot be defined. And so, we take the kids over to play in the front yard at, the grandparents' house. Let them see them playing. It's not just Zoom calls and stuff, but um, the education, I think that is amazingly important during a very serious time, medical time right now, is such that, the more that we can get people to understand why we want things done a certain way, um, the better off we're going to be. And I mean, there's plenty of numbers that you can go over time and time again, but I do find it important from the medical perspective that I don't think it's an appropriate or a reasonable expectation that you're going to get a good response when you're barking orders at people, right?
Hmm.
If you shame them, you need to wear a mask, you need to do that, right? I
Right.
mean, you look at it and go, the evidence for wearing a mask is pretty much irrefutable from any
Right.
reasonable source. Yes, we want everybody to do it, and the evidence isn't just for other people, like what we talked about before. Some of the most recent studies that have come out of the University of California, San Francisco. It's one of the sort of biggest research centers in the world, not just in the United States. um, Talk about the use of masks as, lowering the risk of not just, passing the infection on to other people, um, but also lowering any dose. I mean, no mask is perfect. No mask is perfect.
Sure.
But lowering doses of virus that you get, sort of controlling that, and so sometimes maybe people aren't going to get as sick as they normally would. Reduction of issues on the healthcare system. They've even done studies in animal models. You can't do these in humans, right? You can't really like blow a dose of like a
Right.
deadly virus into a human's face and say, "Hey, how you feel?"
Mhm.
Not exactly kosher.
No.
But they do have animal models. They have done plenty of studies on multiple infectious disease, variants, going back to like the 30s and 40s. That shows a lot of the things about reducing exposure and understanding the reduction of exposure in regards to helping to control
Hmm.
um, the overall effect on society and community, right?
Hmm.
Um, and the topics that we're talking about here, they're not just about infection, they're about mental health, right?
Hmm.
Um, you know, uh, you know, People aren't used to being cooped up in their house. People are getting sick of it,
Yeah.
right? I hear it all the time, and they're like, "We're sick of it. I don't want to do it." And as a doctor, I mean, we are too. you
Right.
know,
Right.
I mean, we don't, you know, the biggest problem is where we need to try even harder,
Right.
probably. It's where we need to educate even that little bit extra and care a little bit more to understand, how is this thing passed? What does that mean for your family and your community? How are we going to get schools back open again? We all want our kids in schools. I want my kids back in school so bad,
Yeah.
man.
Right.
But I want everybody to be safe, right? How do we do that effectively? It's but the stuff that we're doing as a family, I mean, I kind of got off on a tangent, I know, but
Okay.
the stuff we're doing as a family, I mean, it's education for the kids, it's understanding what it means for our extended family members. Um, we obviously are probably even more conservative than most other families in regards to the things that we pick to do because um, I don't want to get sick.
Sure.
I don't want to get this thing, and
Yeah.
it's not so much because I'm scared or anything or whatever. It's because I can't miss work. I
Right.
want to be there for my patients. I want to be there, help them out. If they get it, if something else happens, I got to be around. Um, and it's a conundrum for us just in general in medicine, but the simple things, right? It's the simple things of understanding the education and why you're doing things to protect your family, I think is a huge deal.
Right. No, absolutely. Absolutely. So tell the listeners and myself, I guess, some of the, top information about this.
Sure.
You know, it's a droplet spread, right? There is a viral load, correct?
Sure. Yep.
Being outside reduces that, as well as, you can tell
Yep.
me, is there anything to do with being in the sun at all? Is
Sure.
there, what types of things like that should people kind of understand so that they can kind of make the decisions? Like you said, again, this is the evidence. Here's what it says and what we should consider doing strongly. So go ahead,
Sure.
make your decision.
Yeah, no, I mean, and when it comes down to the evidence on these things, I mean, luckily we're at a different point now than we were 6 or 7 months ago. I mean, obviously a lot of people noticed that, when this thing got out earlier this year, I mean, medicine in general was caught kind of flat-footed. Um, I think a lot of us when we were in medical school, we were taught, it wasn't a matter of if, but when a pandemic was going to happen. uh, the most likely culprits were going to be respiratory diseases because of the way that they pass and the ease of pass that they have. Um, but I think the basics for people to understand, and there's pretty compelling evidence. So we've known for a while that this passes with respiratory droplets, right? So droplets are basically, I mean, kind of what it sounds like, right? They're bigger pieces of mucus that when you talk, cough, and sneeze spread, right? And so why is it that 6 feet thing? Well, that's about how far those droplets go before they fall to the ground. Then there's the concept of aerosol spread. And so aerosol spread is with much, much finer droplets, right? And they can stay in a room for a longer period of time, right? They can stay aloft, they can get on other things. Um, and there's fairly good evidence that there's some aerosol spread that's involved with this thing as well too, not just respiratory droplets. So, um, and I keep talking about things like evidence, right? And so, science, we use the words like evidence and theory and all these things. And really, I mean, we're trying to just get the information. We're trying to get something used in a usable format for people, for
Sure.
us, for people. Um, but we have pretty good idea that there is some aerosol transmission as well
Yeah.
too.
How long does that
And
how long does that take or last, I guess, when it comes to, as you mentioned, if it lingers in the air or on a surface?
so aerosol is probably a little more concerning for spread because it can get in the air and stay in the air, right? But they're finer droplets, so maybe not as much virus in those droplets. Um, and this is kind of where one of the general recommendations really, really, really becomes a big deal, and that's understanding the value of being outside versus inside, right? Um, for families that are cooped up and whatever, I'm telling them all the time, I'm like, get outside, go do something, go take a bike ride, go up to Shelley Lake or something like that. Don't get around a ton of people, right? Don't go to like a motorcycle rally or something in Myrtle Beach, um, but can you go to the farmer's market or something? If you're taking all the right precautions and you're outside, the ventilation is there, that aerosol is going to spread out, and your risk of exposure from that is going to be remarkably lower, right?
Right.
If you're wearing a mask, it makes it an order of magnitude lower than that, right? And so I use a kind of a little bit of an analogy here with people when I'm so like if you're in an enclosed room and
Mhm.
somebody's smoking over there, right? And you're in a closed room, uh, it's going to start to get bad, right? You're going to start really smelling that. It's got nowhere else to go, right? It depends on the ventilation system, but it's got nowhere else to go. Outside is totally different, right? That person smoking over there, you might not like it, but it's not going to be the same thing.
Mhm.
And that's kind of the concept behind sort of the aerosol thing, right? So, um, some of the other sort of work on this, and part of what's also going into things like treatments and vaccines is understanding not just how to disrupt the actual infection cycle, but how are we going to find ways to make this less of a concern or less deadly, right?
Mhm.
And you know, Dr. Fauci was sort of, a long time ago, polarizing figure, but incredibly intelligent man, and has been a public servant for over 4 decades. Um, talked about some stuff to begin with about the nature of this virus just being so interesting that it can make some people so sick that they're on a ventilator in the hospital, and other people just seem to be fine, right?
Right. I
What
was gonna ask
is
you
that?
about that.
What is
Yeah.
that virus?
Right.
And and a lot of that can begun to sort of be explained with some of the newer work or newer study. Yet again, some of the stuff out of UCSF in regards to understanding, the inoculum effect. How much of a virus are you exposed to? How much of a pathogen are you exposed to? And so limiting that exposure, which is where being outside as
Right.
opposed to inside, wearing masks,
Right.
washing your hands, socially distancing,
Right.
is paramount.
Yeah.
And most of the recent data that's been coming out, there was a study that was released by the CDC, I guess, a couple of weeks ago, which some people took it slightly out of context to say that 85% of people that wear masks still get coronavirus versus 89% of people that don't. And that's not what that study was looking at all. That study was actually looking at uh, what are the things that they can tie together in regards to behavioral activities that look like there makes a difference. That's what that was looking at. And what they found was a large portion of the most recent positive results have been from things like eating at an indoor restaurant,
Hmm.
right? Or, people are letting down their guard and attending family events and
Hmm.
having people over for dinner and stuff like that, which, look, I mean, the whole world wants to do that. We all want to do that right now, but yet, I mean, understanding the value of inside versus outside, it makes a massive difference here. But,
Sure.
you know, the people that went to that ate at an indoor restaurant were greater than 50% higher likelihood to get COVID.
Right.
um I mean, you can't wear a mask when you eat, and I think
Yeah.
people, when they're at a restaurant, necessarily to no fault of their own, they're just eating, right? They're
Yeah.
not doing anything that they think is inherently wrong or
Yeah.
evil.
I mean, a lot of the rules say that if you're sitting with your spouse or group, that you can take your mask off, but if you're up and moving around, it's on. I mean, those are a lot of the rules that you see and hear, and that's
Right. But I
again.
mean, in reality, I mean, if you're sitting at the table, I mean, if you're like I am when I eat dinner, I'm talking to my kids, I'm talking to my wife, right? I
Absolutely.
mean, yeah, I'm eating between that as well too, but we're having a whole conversation, we're doing the
Yeah.
whole thing, and I don't have a mask on,
Yeah.
right? And
Yeah.
so that is an exposure risk.
Right. Yeah.
So
I've definitely
um
felt that as well. It's
a-
just
and
yeah.
yeah, and so when you look at it, and it's something that it kind of pains me for the restaurant industry, right? Because I'm a big fan of trying to get the economy back to where it needs to be for everybody, right? Because I feel like that's going to do a lot to help with the general health and wellness of kind of what people are dealing with stress wise as well too. Some of those things, but but you know, but that's just sort of the reality is the
Yeah.
situation, and that's what the evidence is showing. And so understanding what these things mean without the misinformation is probably the hardest part of our job. But it's our job to try to, get people to understand what those things mean,
Mhm.
right?
Mhm.
I'm not mad at people that go that go to the restaurant and don't wear masks. There's no point. That's just ridiculous. But
Mhm.
I do want them to know that there's an inherent risk by doing that. It's there's a risk that they might not completely understand by
Yeah.
doing that.
I love.
And
Yeah, with what you're saying about being indoors and I really enjoyed that smoking analogy, being in a room with someone who's smoking, and it makes me. I'd love to get your confirmation about a different type of analogy for the same thing. It's
sure,
when it comes to the aerosol droplets, and as you mentioned, there's less, maybe potentially less virus in those smaller droplets.
sure,
Um, and so it's the difference between maybe smelling the smoke, which would be just being exposed to those droplets. So
sure.
the less droplets, the less kind of it affects your breathing. You just kind of smell it, and then the more that you're exposed to it, the aerosols, the viral
Hmm.
load, if you will, for a longer time, the longer you're exposed to someone smoking in that same room, you may begin to start coughing. And
Yeah,
so that type of level so again, so when you first get that smoke, you smell it, you're like, so that's kind of just if we walk into a room and it's there. And then there's if we're in a room for an extended period of time with someone just breathing, talking, that would get to a point where it's that room is starting to fill up, and you kind of you huff a little bit, maybe cough a little bit. Would you say that that's somewhat accurate?
I think that, yeah, I think that's a much more or like probably a less medical, a better way to say it than I said it maybe.
You did
So
pretty
yeah,
good. I mean, that was
yeah, no, I,
that was
I
very
I agree with you. I think that's exactly what it is, man.
yeah, interesting. That's cool. What yeah, so you I was going to ask about affecting some but not others, and it sounds like you're kind of um it's still being determined, right? There was a
Yeah, and that's something that's another thing for us to try to get people to understand is there's so many things that are still in flux here, right? I mean, we're
yeah,
still
whether
we're
it's
still finding out
contagious,
so much more.
when is it contagious? Is it contagious with symptoms or not with symptoms?
And so we do know that people that are asymptomatic, and these typically tend to be younger folks, right? Really, really healthy folks without any underlying condition, possibly exposed to a lower viral load in general. Um, yeah, they are infectious for some period of time, but that hasn't been worked out yet. You know, uh, um, I think it is really hard. I mean, like when we take something like the like influenza, right? I mean, we have decades of experience with
Right,
influenza,
right,
centuries really, but decades under really good scientific medical study. And it's taken us that long to figure out exactly what this means for those things. We just aren't there yet with this thing.
right,
But I mean, we're going to get better. It's
right.
going to happen. And those of us in medicine and the people that are a heck of a lot smarter than me doing research
Yeah,
are going to find out so much more,
right,
right? Like as months go on and everything. But um, I'm very optimistic about the fact that, this is not something that's going to last in perpetuity, right?
right.
This isn't like, this isn't like, the new, I do think masks at one point in time in the future are going to be something that is more of maybe an optional thing. I mean, I think a lot of people think it's optional now, but um, doctors would say it's an optional
Right.
thing in regards to guidelines or mandates or whatever. But um, I mean, I have a lot of faith in the fact that sort of knowing where we've had
Right.
we've already come, and what we've been able to do in the past in regards to a lot of really smart people getting this work done, that we are going to come to an end at some
Yeah.
point in time,
Yeah.
right?
Yeah.
We're going to have more knowledge about this, but it is going to take time.
Yeah.
And yeah, people are going to get sick of it, and I am too, and you are too, and our kids are, and everybody's going to. And um but no matter what, I mean, people are still working on this thing really, really, really
Yeah.
hard, and we're not going to rest until it's done. So
Right.
I'm not like doomsday about it. I'm definitely more
Right.
positive about, hey, this thing is going to be overcome.
Yeah.
It's going to be something that is going to be a thing of the past eventually.
Yeah. Absolutely. Absolutely. I agree. I'm with you with that. I think, something's it's gonna come to, whether it's a vaccine or again,
Hmm.
learning more and understanding it more, and how it's transmitted so that we can better take precautions. Even, making sure that we're
Yeah.
getting the right information and correct information and good education on it. And, eventually at some point it'll either be, where if you're sick, wear a mask, or, all that stuff eventually, but yeah. So
Oh yeah.
thanks for all
Completely
that.
agree. Yeah.
Thanks for all that. When it one more kind of doctor question, and then a tiny bit about you before we finish up. When it comes to our current time and what we're going through, how much more have you had to help people accept and help people get help with their mental health?
So this is a big concern of ours, especially in primary care. I think that the amount of appointments that we're having for anxiety, stress, depression, insomnia, those types of things are skyrocketing right now. We've always had those appointments. We've always been on the front line of those things in primary care, but I think it's an expected thing. And I also feel like it is part of our job as primary care physicians to try to make sense of that for people. Um, but like I said, I mean, kind of do it in the way of, educating people. Hey, you can still do something. There's just this, you don't have to be, in this particular light. There's a few more freedoms that you probably can allow yourself, that are safe, and that you're still going to be fine. But yeah, we're seeing a lot more of that. I've got a few other friends, in the, in the biz, I guess you will, like in medicine, that or therapy. Got a pharmacologist friend of mine that we talk about this stuff regularly, right? Mental health and well-being is something that this country has needed to face down harder for a really long time, right? And in my experience and everything, not just with COVID, I've seen it with our military personnel, with new mothers, retirees. There's so many different subsets of the population, minorities, whatever, that that you have to look at this stuff and listen. And so, um, you know, this is kind of one of those plugs that I would use for, if there is a problem, if there's something that's going on that you're not handling well, um, if you feel like you're having to self-medicate with alcohol, or you're having to, um, you know, and sometimes, I've had patients that have come in and they feel bad, right, that they've done that.
Mhm.
And I'm kind of looking at them going, you know, this is a weird time. It's 2020, let's get to work. Let's help you out. You don't have to be that way. You don't have to accept that, depression and anxiety and sort of low place. There's people that care. There's people that are going to understand and that are not going to judge you, that are not going to, put you into a lower place,
Right.
we're there to pick you up, and we all go through times, I mean, it's stupid of anybody of us to deny that we don't go through times where maybe it is harder for us,
Right.
right? Burnout and some of those things as well too. But I urge anybody that is having issues, with dealing with isolation or stress, anxiety, depression, or anything, to reach out,
Mm-hmm.
talk to your primary care physician. If you need to get, a counselor or a therapist involved, we do that. That's something that I can't urge people enough to do. I think it's a huge part of this concern.
Mm-hmm. Yeah. Yeah. Well, thank you for that. I think that's vital now. And yeah, like you said, people are self-medicating with all sorts of different things, and handling it in different ways. And if they could just, if they have someone to trust and someone to be open with, and
Yeah.
help, it's paramount. Yeah.
And some people are having more overuse injuries too because they're self-medicating with running and cycling
Right.
and those
Right.
things.
Right. Right.
So it's like, hey man, I get where you're coming from, but we got to get this back too. All right, this has got to be healthy for you, man.
That's right. There you go. I like that. Yep. You're exactly right. Yeah, it could be anything. It could be, like you said, alcohol, could be exercise, could be food, could be, yeah, just wanting to be alone. Anything, any way, social media, being on your phone for extended periods of time because
Oh yeah,
because that's what that's a form of addiction. So, um,
absolutely.
so yeah, so it's huge. All right, well, let's turn it around. Let's talk a little bit about you, and we've touched on a bunch of different things, and how you care for people and the things that you enjoy about your job. Um, tell me just, I want to learn a little bit about you. What are three things besides your family, friends, and your career are you passionate about?
Um, I am passionate about playing guitar.
Cool.
I've always been a musician at heart. um, Grew up playing piano. My mom had me take piano for like 6 years or whatever when I was younger. And then I picked up guitar in high school, and my wife would probably tell you I have a little bit of an addiction when it comes to having guitars and those things.
Yeah,
Um,
that's cool.
I should play them more often because it is one of my forms of therapy. The kids love it.
Yeah.
So that I've become a really big golfer, especially with the socially distanced nature. I love getting out, and being outside, fresh air, beautiful environment around me. There's something very cathartic about that. Um, and I think other than that, um, I mean, my wife and I, we like to cook. We like to do stuff. That's something that we should probably do more of. We used to do that a lot when we were first getting together. Um, I think the year that she and I were engaged, we had a spectacular time. Cooking different things, coming up with different recipes, stuff like that.
Yeah.
And so it's some things that I miss. My wife definitely does it with the kids now.
That's awesome.
Bake cakes and apple pie recently that was amazing. So
Love it. Nice. Cool. Very cool. I like it. If you could be an animal, what animal would you be?
man, you're gonna hit me with that one, huh?
I know I got some sneaky ones in here that I didn't tell you about.
So my 7-year-old made me take a National Geographic quiz about which animal you should be last night, and it said I was a sloth. So I'll stick with the sloth. Okay.
That's awesome.
And it wasn't like in a bad way. I wish I had it sitting in front of me, but it was one of those things where it was like, you're more relaxed, you're more chill, you take things kind of, as they come, and that type of thing. Not so much like, hey, you are,
super slow,
no good and do nothing. I do a lot of things. So
well, yeah, no, definitely. All right. What is, if you eat it, what is your favorite ice cream flavor?
Ice cream flavor? Butter pecan.
Ooh, that's a good one. Yep. Yep.
Yeah, by a long shot. Yeah.
You got to try the Bluebell one if you haven't already.
Actually, at Two Roosters, they have a really good one when it's in season 2.
Yeah. Yep. Right around the corner.
So local ice cream.
I'll check that out.
It's a plug.
That's right.
No money, just a plug.
I was gonna say, are they fun? Are they paying? No.
I don't know. Maybe I'll get a T-shirt out of it. I don't know.
T-shirt or a free cup, right? There you go. Cool. What are 3 books that you enjoy recommending or gifting?
So, um, I've always been a really big fan of autobiographies. Uh, I will admit that I don't always read for pleasure. I think most of the reading that I do is academic.
Hmm.
I tell people that I've probably read more textbooks in my life than I'd like to admit to anybody. Um, so I read, newspapers, magazines, and stuff all the time. I mean, but my wife is a huge reader. But I've always been a big fan of autobiographies. I just enjoy sort of, understanding, and that doesn't matter. There's a lot of different autobiographies that
Hmm.
I've read that are pretty amazing. Um, it's not an autobiography, but there was a biography about Nelson Mandela that was pretty amazing that I read. um Growing up, I mean, some of the simple books, things like, To Kill a Mockingbird, some of those types of ones right there. And for anybody that's got kids, the number 3 book, and the book that I highly recommend to anybody with kids, is a Sandra Boynton book called The Belly Button Book. It is a must have for any father or mother out there. The Belly Button Book.
It's called The Belly Button Book.
Yeah, I've almost got it memorized. I won't scare you with it right now, but it's by
Okay. Yeah.
Sandra Boynton. Amazing child kids book writer. Amazing.
Okay. I'll check it out. I felt like you were talking to me with that one.
The Belly Button Book.
Our daughter does enjoy, I think last month or the month before, her favorite book was Where's My Belly Button? So
Hey man,
that might
everybody wins.
that might be that might be her upper alley. All right, cool. And then what if you were to have a billboard on busy highway around here, I-40 or 540 or 440, and thousands of people saw it every day, what would you write on it?
I care.
Cool. I like it. I like it. It's important for people to hear.
Yeah, I think that I know your podcast is about wow. I mean, I'm very happy that you're doing this, Bill. I mean, I think this is awesome. I know I screwed your name up at the beginning. I'm sorry, man. That's
I know you know my
People are
name.
probably going to make fun of that, but whatever. So
It's all good.
they'll be like, "Oh, he doesn't really know that guy," and they'll be
Yeah,
like, right all the way at the end, they'll be like, "Oh, yeah, he does know him."
it's
Okay,
all
cool.
good. Yeah,
But
that's funny.
but no, I mean, we got to keep it together. I mean, we gotta stick through this.
Right.
Um, I'm in it to win it. I want everybody else to be too. And if they need help, ask for it, man.
Yeah. Yeah. Absolutely. Very cool. All right. If anybody wants to get a hold of you, whether they have questions about COVID, whether they have questions about sports medicine, whether they want to switch to you or your practice as primary care, um, what
Sure,
is the
sure.
best way for them to get a hold of you and pick your mind or just talk?
So I mean, our practice. I'm proud to say that all the docs that I work with, I have a very large respect for, and so if anybody is looking for a good primary care doctor, at Carolina Family Practice and Sports Medicine, we have locations in Raleigh, Cary, and Holly Springs.
All right.
Our Holly Springs location is pretty bomb, to be honest with you. I've been out there. The office is kind of futuristic, sort of Star Trek like. You like wave your hand, the doors open. It's amazing. The docs out there are just absolutely amazing. I mean, they're
Yeah.
good people, good hearts. They care. Uh, and so our phone number for the office, if you're looking to make an appointment or looking to get a new doc, is 919-238-2000. Uh, Feel free to, we have our website, cfpsm.com. And we have a lot of different, health topics and stuff like that on there. We do run the Carolina Sports Concussion Clinic as well, too. Something that we've been doing for 12 years now. We've been
Yeah,
working in research with UNC for a long time.
that's another
Um,
podcast.
so obviously kind of a niche, kind of a thing that we do. We have a subspecialty in concussion care. Um, so yeah, I mean, whether it's with us or with anybody, I have a lot of friends that are amazing docs in this area, people that I either trained with or went to med school with or have had the good fortune to come across just in the context of my career. and we're lucky in this area. We are a lot of really, really good folks.
Yeah, absolutely. Well, thank you so much for your time. Again, thank you for giving everybody this awesome information, whether it's on coronavirus or just general health. I hope it helps at least one person, if not many. I really appreciate it, and
My
thank
pleasure,
you.
bud.
Yeah, thank you, everybody listening. Thank you so much for listening, and for now, be well and thrive. Thank you for listening, and I hope you enjoyed the podcast. I would love to hear from you on who else needs to be heard and highlighted in the Triangle area. For ways to reach out with questions, recommendations, or comments, please see the show notes. But for now, be well and thrive.